Hi, my name is David Emerson. I'm a long-term multiple myeloma survivor and myeloma cancer coach. Welcome to the Cure versus Control debate video blog. The main philosophical approach for myeloma therapy is the cure versus control debate, while it might not be stated as such. In general, high-dose aggressive chemotherapy, such as 3, 4, 5, 6 rounds of induction chemotherapy, doublets and triplets, followed by an autologous stem cell transplant, is designed to cure a patient's multiple myeloma. While it might sound odd to use the word cure for an incurable cancer, that is essentially the heart of the debate. Low-dose maintenance therapy, as an example, is meant to control a person's myeloma for as long as possible. Therein lies the debate. High-dose aggressive therapy, cure; low-dose maintenance therapy, control. Factors to consider when deciding your own therapy plan are your age at diagnosis, stage, and symptoms. For example, earlier stage myeloma is easier to control, requires less chemotherapy in theory to control. Those who are diagnosed with a great deal of bone involvement or a higher stage, stage 3 multiple myeloma, chances are would have to undergo more chemotherapy, higher toxicity, in order to bring down their metrics, M-spike, those kinds of things, to basically try to go for or ensure a longer progression-free survival. Progression-free survival is a fancy expression, fancy phrase for remission. Studies show that stem cell transplants, autologous stem cell transplants, do relate to longer progression-free survival, not longer overall survival. Overall survival is length of life. Progression-free survival is length of remission. It's common for myeloma patients to achieve multiple remissions. The goal is to achieve the longest remission possible. My personal experience is that evidence-based but non-toxic therapies can increase or lengthen progression-free survival. Integrative therapies such as curcumin, for example, have been shown to enhance the efficacy of chemotherapies such as Revlimid, Velcade. There are therapies, non-toxic therapies, shown to reduce the toxicity of chemotherapy. Exercise, excellent for strengthening a person's bones. Whole body hypothermia, anti-myeloma nutrition. There are a host of evidence-based but non-toxic therapies shown to reduce the risk of myeloma. So, to summarize, your job as a newly diagnosed multiple myeloma patient is to try to learn as much as you can, granted very complicated cancer, in order to decide, think through your own therapy plan. Am I going to try to hit my myeloma with a hammer in the form of aggressive induction therapy and an autologous stem cell transplant and low-dose maintenance therapy following that autologous stem cell transplant? Or is there a path of less toxicity to control your multiple myeloma? Again, talk to your oncologist. Try to think through your symptoms, your stage, and your goals as a myeloma patient. Talk to your caregivers. Think through what you want to do as a myeloma patient. If you have any questions, scroll down the page, ask me any and all questions. No question is too small. No question is silly. I encourage you to learn as much as you can about myeloma. In the meantime, I wish you well and take it easy. Thank you for your time.